Would you say that having had a concussion puts them at higher risk for further concussions down the road? Do you see that often?
Absolutely. Especially when we talk about athletes, they are the most at risk for second impact syndrome. And that's a teenage, age group.
Gotcha. Yeah. And would you say you see a difference between like male and female rates, if you will? If I had to guess, I would say that you got more male patients with traumatic brain injury than female, or is that way out of left field? I'm just thinking of
No,
kids
you
playing
know what?
football
So
and
I
contact
think it
sports.
varies. I do think
Okay.
that more women suffer from mild TBIs baseline.
Really?
There's certain factors and hormonal changes that make them more prone to that. So in the teenage group, I would say, yes, athletes in general are more at risk than the normal population of like falls and things like that in the older group. But as far as all across the board in pediatric patients or in general, I think females are more prone to it, TBIs. But I do think the athletes are just a different section in itself, that they're just at a much higher risk. And so that's the one thing that we need to tell parents and educate parents on, is basically saying, yes, your child suffered from a TBI. Yes, they can get better from it. Yes, these are the treatments to do, but they are at risk of, worsening symptoms the second time that they have a TBI. So really, we need to make sure safety precautions are in place. They're wearing helmets, they're wearing proper gear, and that if they feel off a little bit or are suffering from, a big hit, that they just sit out for a minute, collect their thoughts instead of, pushing through and causing worsening symptoms.